Now I will talk on use of tourniquets in total knee arthroplasty. Tourniquets continue to be widely used in total knee arthroplasty to help reduce blood loss, although their use during uncomplicated primary elective total knee arthroplasty has long been debated. The evidence is conflicting regarding both the beneficial and adverse effects of tourniquet on blood loss and post-operative function and pain. The effects of tourniquet used in total knee arthroplasty. A randomized controlled trial study published in Knee Surgery Sports Traumatology Arthroscopy Journal 2017. A randomized controlled trial evaluated the effects of tourniquet used in 50 patients who underwent staged bilateral total knee arthroplasty. For each patient, the first TK was randomly allocated to either long duration tourniquet use from before incision until after the cement hardening, or short duration use from before cement application until after hardening. 3 months later, the opposite strategy was employed in each patient's contralateral knee. Authors found that less total blood loss with the long duration use, whereas short duration use reduced post-operative blood loss. Short duration use also resulted in faster recovery and less pain during first 6 weeks after surgery. Transfusion rates were similar in each group. Another prospective double-blinded randomized controlled trial published in JBJS 2019. In a separate double-blinded RCT, authors found that tourniquet use significantly decreased blood loss and improved surgical field visualization without adversely affecting post-operative outcomes. These authors concluded that routine tourniquet use is safe and effective, and concerns about the deleterious effects on function and pain may not be justified. One more study published in JBJS 2017 on use of intravenous and topical tranexamic acid and tourniquet. A third RCT compared the use of intravenous and topical tranexamic acid alone to tourniquet use with and without tranexamic acid for primary total knee arthroplasty. The authors found that tranexamic acid group without a tourniquet had less hidden blood loss, less post-operative knee swelling and pain, and lower levels of inflammatory biomarkers than the groups that used a tourniquet. In addition, the no tourniquet group had a better early knee function and higher satisfaction levels. One more study published in JBJS 2017 on tourniquet use. A retrospective cohort study evaluated 3 different groups with respect to tourniquet use. The authors found that the group with the limited tourniquet use during cementing of components paradoxically had the highest mean calculated blood loss. The second group had a tranexamic acid and tourniquet use, and these patients experienced less blood loss than the first group. Patients in the third group received a tranexamic acid with no tourniquet, and they had the least blood loss. Authors concluded that surgeons should consider omitting routine tourniquet use in total knee arthroplasty. Peripheral vascular disease and tourniquet use. Many patients undergoing total knee arthroplasty have a peripheral vascular disease, often resulting in radiographic evidence of arterial calcification. Such calcifications may be associated with delayed wound healing and arterial thrombosis, and the stiffened arterial walls in such patients may lead to tourniquet failure and increased blood loss. A prospective cohort study involving more than 2,500 patients included 86 thighs with a vascular calcification. The authors found that the presence of arterial calcification on pre-operative radiographs increased the risk of tourniquet failure when the tourniquet was inflated to 300 mm of mercury. However, compared with the calcification-free patients, those with arterial calcifications had no significant increase in rates of blood transfusion or increased complications related to wound healing or ischemia. Arterial calcification and pre-operative radiographs increases the risk of tourniquet failure. Coming to the conclusion, in summary, there are pros and cons to the use of tourniquets in the total knee arthroplasty. Multiple factors, including the complexity of the anticipated procedure, and patient's comorbidities should be considered in the tourniquet use decision.